Hello, class. Have you ever thought about what you would do if there was an emergency at home or in your classroom? Let's think about a few different scenarios. What if you came across a student in the hallway that was unconscious? Or a friend in the lunchroom that suddenly starts to choke on his or her lunch? What would you do? Would you help or would you panic? Well, that's okay because today we will learn some basic procedures to use in these situations. So, what does first aid and CPR mean? First aid is the initial care given by a responder with little equipment to someone who is injured or suddenly becomes ill. CPR stands for cardiopulmonary resuscitation and is a combination of chest compressions and rescue breathing. By following basic guidelines before giving first aid and CPR, this will protect you from further harm. So avoid contact with body fluids such as blood. Place barriers such as disposable gloves between you and the victim. Use breathing barriers if available. Wash your hands with soap and water immediately before and after giving care, even if you wore gloves before. Do not eat, drink, or touch your mouth, nose, or eyes when giving first aid to a victim. Here's a picture of how to wash your hands properly. Do not forget to wash between your fingers, under your nails, and on the tops of your hands, and be sure to scrub for at least 20 seconds. Okay, so let's begin with CPR. Before providing CPR, you need to assess the scene and ask yourself, is it safe for yourself? Assess the patient and ask, are they conscious or unconscious? Ask the person if you can help. If unconscious, you always want to help. And quickly call 911 or send someone to call 911 for you. Once you see that the scene is safe, look for signs that could have caused the problem. Check for responsiveness by tapping the person and shouting, "Are you okay?" If the person is unresponsive, call or send someone to call 911 and get the AED if there is one. Look for any other signs of injury and then use your ABCs to check the airway, breathing, and circulation. After you do these steps, you are ready to begin basic CPR. Here is a complete list of steps that you need to do in order to perform CPR. So check the scene. Send someone to call 911. Open airway by doing the head tilt chin lift, showed here, and then check for breathing. If no signs, begin CPR immediately. You want to push hard, push fast, and place your hands one on top of the other in the middle of the chest. Use your body weight to help you administer compressions that are at least 2 inches deep. Deliver rescue breaths. With the person's head tilted back slightly and the chin lifted, pinch the nose shut and place your mouth over the person's mouth to make a complete seal. Blow into the person's mouth to make the chest rise. Continue CPR steps. Keep performing cycles of chest compressions and breathing until the person shows signs of life, an AED becomes available, or EMS arrives on the scene. So what would you do if someone around you was choking? If the person is breathing and can talk, you do not want to interfere with his or her attempt to displace their object themselves. If not breathing, here are some signs that you should look for. Unable to talk, turning blue or purple in the face, clutching their throat, high-pitched sound while trying to breathe. When you see these signs, act to relieve obstruction. Performing manual thrusts is called the Heimlich maneuver. So you want to stand behind the person, put arms around in front, make a fist and place thumb side up into area just below the breastbone and above the navel. Grab fist with other hand and give 5 quick inward upward thrusts until obstruction is relieved, help arrives, or victim becomes unconscious. If the victim becomes unconscious, you want to begin CPR. And the last thing I want to go over is controlling bleeding. You can stop most bleeding by applying direct pressure alone, but first you want to make sure you wear gloves to protect yourself from disease transmission. Cover the wound with sterile gauze and press firmly against the wound. If dressing becomes soaked with blood, do not remove it. Apply additional dressing on top of the wound. Elevate the injured area above the level of the heart if you do not suspect broken bones, head, neck, or spinal injury. You want to call or have someone call 911 if there is a lot of bleeding, you cannot control bleeding, you've seen signs of shock. Here are signs listed here. Or you suspect a head, neck, or spinal injury, or you are just not sure what to do. For small wounds, you want to make sure you clean wounds with soap and water to avoid infection. Use ointments or creams such as Neosporin and then reapply dressing. You never know when a medical emergency is going to happen. This is your chance to become the hero.